Movement of the knee joints are pretty basic at first glance because there's flexion extension in the sagittal plane. But we also want to think about how does that movement occur open chain versus closed chain. So remember, open chain is the distal segment or your lower limb moves relative to your proximal segment. So if you're sitting down or standing up and you flex and extend your knee joint by kicking your foot out, that is open chain. Closed chain is when the proximal segment moves relative to the lower segment. So if you are doing a squat, your upper body, your proximal segment, thigh will move relative to your lower segment. As I said before, flexion extension occurs in the sagittal plane about the medial lateral axis. You have about 140 degrees of flexion, and extension technically occurs beyond the zero position or anatomical neutral, and you might get 5 to 10 degrees of extension. But typically, you do not see your foot extending about your knee joint. That would be a very abnormal motion. So for knee, we see knee flexion, and then extension is the return from a flex position to an extended or neutral position. We also have arthrokinematics. So flexion extension is osteokinematics. The arthrokinematics are very small movements, glide, roll, spin. So the round femoral condyle on this flat surface, you can imagine that this becomes a problem. So when we are moving in flexion extension, say the tibia on femoral extension, so your tibia is in a flex position and it starts to extend, you'll have a slide, an anterior slide, and a roll of the femoral condyle on the tibial plateau. If you are extending from a squat position, so your femur is moving on the tibia, you'll still have a roll and a slide backwards. And they call that the screw home rotation. Your knee kind of locks when you get into that extended position. Another movement that occurs at the knee joint, and we said earlier that it's kind of a hinge joint, flex extend in the sagittal plane, but at 90 degrees of flexion, so you can see this person is flexed at 90 degrees, you can have knee external rotation and knee internal rotation. So you can externally rotate about 30 degrees, internally rotate about 15. And that only occurs when your knee is flexed 90 degrees. We also have, we're calling them movements in quotes, the idea of valgus and varus knee. Your knee, and this is in the frontal plane, and that's why you see terms like abduction and adduction. This is more of a postural, quote unquote, movement. Your knee does not typically move into AB or adduction, but you could have knee valgus, which looks like your knee is abducted. And what that looks like is somebody's knees kind of collapsed or knock-kneed posture. You can also have knee varus, which is adduction. So your tibia going towards the midline, and that can look like kind of a bow-legged posture, and that's knee varus. I'll add a discussion or a definition of the screw home mechanism to this movement or motion video. And this is when fully extending. So when you go from flexion to extension, your knee, quote unquote, screws home. So as you approach full knee extension, your tibia externally rotates approximately 10 degrees to achieve a perfect alignment between the tibial plateau and the femoral condyle. So it kind of locks into place. In full extension, you have the close congruency of the articular surfaces and no rotation of the knee. When you start to flex from full extension, your tibia unlocks by internally rotating, and then you can go into flexion. When you're in a closed chain motion and you're extending your knee with your feet planted, the femur will internally rotate and lock into extension. So why does this happen? It's the shape of the medial femoral condyle. It's also due to the lateral pull of the quadricep muscle group and the tension in the ACL.